Yeah, our colleagues at Fred Hutch and working with our pharmacy team, we try to look at the patients who received Venetoclax, and we focus on patients who had low or intermediate risk for tumor lysis syndrome. As we know, there's currently an intensive recommendation for monitoring of patients at the time of Venetoclax initiation, and we're noticing in clinic that many of these blood draws and visits do not lead to any intervention. So we basically bring the patients back multiple times, we check labs, but we don't do much about them. So trying to put this systematically in a presentation, our colleagues looked at patients with lower intermediate risk CLL, and it confirms the fact that many of these lab works and follow-ups are really not necessary. So the point is that this is a single institution, small study, but we need more reports, and there are more reports being generated from other institutions. It's not intended to change the practice, and of course our recommendation is to follow the label specifically and do it the way it should be given, but the idea is to generate a hypothesis and hopefully a prospective study that may lead to regulatory changes for these patients with low-risk disease. But of course that's something that has to be done with involvement and by the industry colleagues and collaborators. But these are the type of data that will help those questions to be answered at a higher level.